Welcome. I'd like to start at the beginning by addressing why we're here. In May of this year, the Aberdeenshire Integrated Joint Board instructed officers to carry out a strategic review of service needs for residents of Insch and surrounding areas, in order to develop options for health and social care services which will be fit for the future. If we don't, there's a risk that we fail to deliver the standards of care expected in the right place and at the right time, as both the needs of the community changes, but also as new ways of delivering care evolve. There's a vast array of health and social care services that operate in this area, including many that visit people in their own homes, such as district nursing and home care. We also have something called the virtual community ward, which involves professionals wrapping care around a person when they are at risk of being admitted to hospital and providing intensive support to keep them at home instead. We also have Insch War Memorial Hospital, and you may be aware that to some extent there have been difficulties in keeping this going as an inpatient facility. This means we have to address it with the community, and this offers us an opportunity to look at all our health and social care services and explore different ways of doing things and aspiring to do them better. Now I've set the scene, I'd like to talk a wee bit about place, because for Aberdeenshire Health and Social Care Partnership, place is of utmost importance. That is why when the Health and Social Care Partnership was formed, we organised ourselves into localities around communities. The place where we live and the community we belong to is significant in all of our lives, and that is why it's really important that you have a say in this strategic review process to help us understand your lived experience and what is important to you. Using the place approach can be complicated because it's more than looking at individual services or resources. Our health and social care services are interlinked, so making a change in one can often have knock-on effects elsewhere. But more than that, someone's life in a place and their experience can be changed by the way in which interventions from health and social care come together. Thank you.
Hi everyone, I'm Geraldine Fraser and I'm one of the partnership managers in the Aberdeenshire Health and Social Care Partnership, and I'm really pleased to be able to share with you the results of the survey. We used the Engagement HQ site for people to register their interest in the project, and we can see that it has generated a lot of interest, which is fantastic. We had over 4,000 hits on the project page, and most of the visits involve people looking through the information on the sites. 1,365 people registered interest in the project and 960 individuals completed the survey and 12 community groups completed the survey. We combined the online results with the additional surveys that were completed by paper. We asked what was most important to the community about health and social care services. This is to understand the community's priorities for our services. We provided a series of statements and asked people to select the ones they felt were important to them. These results show the top 2 highest scoring statements and also the lowest scoring. The statement that most people identified as being important to them was that they can access the appropriate healthcare professional timelessly and receive the care, advice or treatment that they need for their condition. And 72% of the responses selected this. 67% of people agreed that it was important that support and services are available close to home. These were the 2 highest results. Fewer people thought it was important that transportation is available for medical appointments, with only 23% of people agreeing that that was important to them. We asked people to rate whether they agreed that the Health and Social Care Partnership was meeting people's outcomes so that we could gauge how close we are to achieving these. There was a positive response to all of the statements. 80% of people agreed that they have the knowledge and confidence to take responsibility for their own health and well-being. 63% of people agreed they know who to turn to when seeking advice, care or treatment and feel confident and comfortable in doing so. And 63% also agreed that they feel safe, involved and included within their community. Only 25% of people agreed they would be willing to travel in order to receive specialist advice and care. We also asked people to comment on the developments we would like to build on, and the comments through the survey showed that people were generally in agreement with these. A lot of the comments related to technology, that it has its place, but that it's not right or accessible for everyone, nor will it be right for every type of contact. There were a lot of comments about the community spirit in Insch and support for involving the community in decisions. We asked people to comment on what we see as the challenges, and in this section, most of the comments related to the hospital and support for it to reopen in one way or another, and for it to be used to provide services for the local community.
Hello, my name is Paul Davies. I'm one of the GPs from Insch Medical Practice. I've been asked to present to you some data that we've been collecting over the years. This first diagram is from 2005, which is when our digital records first began, right up to this year. Interestingly, when you look at the peak age groups, back in 2005, the most common age group in Insch was 35 to 45 year olds. At the moment, that's 55 to 65 year olds. The practice population really has remained quite stable over the past 7 or so years. But the big change has really been looking at when we break age groups down by these criteria. So the 85-year-old groups, as you can see, has increased in number from 2005 fairly steadily. Equally, 75 to 85-year-olds and 65 to 75-year-olds, all of the groups have increased in number quite steadily since our records began. Along with that, we've also seen an increase in the incidence of chronic disease. All of these diagrams really show an increasing trend, but these are the main chronic diseases that we would monitor within the practice, and we do that to identify people who are going to be most at risk of needing health and social care. The same thing on this further slide, we also monitor dementia, obesity and cancer, all of which again have shown an increasing trend. A couple of things that we do within the practice to try and identify those at risk. One, we keep a frailty register where we have a mechanism of identifying people who may be more increased risk of medical need. And also we keep a palliative care register which identifies people who would be approaching end of life. Now, although this diagram may look quite alarming in its increased numbers, part of this is explained by the fact that we now identify palliative care from all chronic health problems, whereas perhaps many years ago it was more considered to be something related to cancer diagnosis. That's not the case anymore. We do, so for example, we will also include people with end-stage lung or cardiovascular diseases within this category. The last slide I want to show today is to show where people's end-of-life care is taking place. This slightly dark grey bar here is Insch, and of course since 2021, or really in part of 2020, there's been no deaths in Insch, of course, with it currently being closed. With that, we have seen an increase, of course, in deaths in other community hospitals. Also an increased death at home, which is this orange bar. But unfortunately, we are also seeing an increase in people dying in acute hospitals in ARI and also, unfortunately, the Children's Hospital. So as a very quick summary, we can quite clearly say that in Insch, based on the data we have, people are definitely living longer. It also appears that people tend to stay here in Insch. The first slide what I showed you with the change in population dynamics compared from 2005 to today, really the 16 years, it looks like just those same people have just gotten older, and that bar has shifted to the right. The other thing which is quite clearly demonstrated by this is the relationship between getting older and increasing health needs. And all of this needs to be taken into consideration with what you need to discuss about how we move forward. Thank you very much.
My name's Philippa Jensen, and I've worked in health and social care in Aberdeenshire for the past 15 years. The last 5 of those, I've been the health and social care manager at Insch. So I have witnessed during that period firsthand how supportive and inclusive the community is, and how it advocates for health and social care services and for the staff that run them. And that has been particularly evident throughout the pandemic, which has challenged us all in unprecedented ways. The partnership have been overwhelmed by your participation in this piece of work so far. It illustrates just how invested you are in what's happening in the community and how keen you are to be part of the discussion and the decision making about what happens next. And your involvement and commitment is an enormous asset. As you're aware, the Strategic Needs Assessment is being undertaken to understand what the health and social care needs are. So it's not about specific services at this point, but rather it's about understanding what's important to the community in terms of services and in terms of how they're delivered. Also learning about the demographics and what we can expect in terms of demand over the coming years. But having just explained that this piece of work is not about specific services, it was very clear throughout the survey submissions that people want to talk about Insch War Memorial Hospital, so I will address that now. The hospital was built upon immense generosity and compassion, and to invest in the future of the village and of the people in it. It holds great social and historical significance for many people, and I want to take this moment to acknowledge that. The hospital was built, as you know, at the end of the First World War, and the memorial is central to it, both literally and figuratively. And the hospital has continued to give meaning and provide care for almost 100 years, and it's an important and highly valued asset to both the partnership and NHS Grampian. But for a moment I will have to transgress from talking about what the hospital means and what it stands for in the community to provide a bit more detail about the building, about the shell, and how it performs in its function as a modern healthcare facility. And healthcare and building standards were understandably very different in 1922 when the hospital was built. Nowadays there are concerns in respect of fire safety and evacuation and infection prevention and control. And since I have had knowledge of Insch Hospital, there have been numerous risk assessments in place which are able to mitigate some of these risks, but they cannot be altogether removed. The risks arise from the size of the building, of its corridors, rooms and doorways. They're just too small to move beds and other equipment through the doorways and along the corridors. So, put most simply, this is a problem if there's a fire and we have to evacuate patients safely and quickly. The rooms don't meet the minimum space requirements that would allow staff to care for people using equipment and to allow for safe distancing between patients. The room and the bed space requirements aren't new, but NHS boards are expected to implement them. And since the pandemic, inpatient areas have been reassessed in line with these Scottish Government requirements. And we've become all too aware over the last 18 months how important it is that we adhere to these requirements and protect people from cross-infection, whether that be from COVID or flu or winter vomiting bugs, because they're all extremely contagious and can have life-threatening consequences.
And it brings to mind the quote from Florence Nightingale, which is that the first requirement in a hospital is that it should do the sick no harm. So these issues are very real, and they mean that we must consider seriously the best use of the resource that we have in the hospital, but alongside the myriad of resources we have in the community, such as care at home and district nursing, as well as new alternatives, and decide how to deliver what the community needs. The hospital will continue to be valued and cherished by the community, by NHS Grampian and by the partnership, but we need to find a role for it that matches its capability, and that's what the discussions here today are about. I know that this will be difficult to hear and it's disappointing. I know that because it was for me too. And despite the fact that I have had now to deliver this message on a number of occasions, it doesn't get any easier. But I do it in the spirit of honesty and openness, and with a request that we can look forward together, and we find a way that might be different from the past, but nonetheless with positive outcomes for the community and for people that use services. So now we want to listen to you. We want to hear your views. We want to learn from you. There are no trick questions, no right or wrong answers, but your voices are very powerful, and we want to benefit from the experience that you bring, because this community has helped to shape services for the past 100 years, and we want to continue that legacy.